community. So for those folks that are in that 18 to 22-year-old age group, we know that you have the ability and that you care about our community, and we want and need your support in order to make this a successful endeavor. Even with our orders in place, we can't be everywhere all the time, and we need to have people take this seriously and make sure that they're following the orders themselves. I also want to talk about why this order is so important to us, because the governor's office about a week ago released what's called the dial, their indicators for each community across Colorado. And they have measures that relate to what level of protect our neighbor versus all the way to stay at home you would be in based on those indicators. And the indicator that is most concerning to us right now, so if we look at our hospitalizations as an example, our hospitalizations are stable. That is one of 3 indicators that the state looks at in determining what classification you fall into on that dial. And then another indicator is percent positivity. And our percent positivity is increasing some, but it's still below levels in the dial that would force us to shift to a different level. And I'll talk a little bit more about that in just a second. But the one that is outside of where we want to be is that rate that Sam talked about early on. And that is, again, due to the outbreak that we're currently experiencing with this 18 to 22-year-old age group. So we need to get that under control. We have put some things in place that I know other partners are going to talk about as well. And we do expect to see some change in the next 2 weeks. One of the things that's important for people to keep in mind is that when an order goes into place, that order takes effect, and then the incubation period is 14 days or less. So once the order goes in place, it stops the disease from spreading, but we don't actually see the indications in our data till a couple of weeks later. So I just want to make sure that people on the phone are aware of that. The other thing I wanted to talk about is just the importance, again, of masking, and that masking can make a huge difference. So social distancing, masking, and washing hands can stop this disease from spreading. Hence the importance of not gathering, making sure we're staying separated at 6 feet, and wearing a mask. We know those things can slow and stop the spread of this disease. If we don't slow and stop the spread of this disease, then it puts our entire community at risk. It puts us at risk for moving to a more restrictive state, which can interrupt and have significant negative consequences on our businesses. It can disrupt our personal lives and our quality of life, including social and behavioral health aspects. And it can certainly have negative and severe impacts on our highest risk population. So we need to take it seriously. It will come down to people's personal behaviors, in addition to the support of some of these measures that are now in place. It's a lot of information. I'll stop there at this point and turn it over to the next person.
Thank you, Jeff. I appreciate it. It was suggested because we were not recording originally. If people who are speaking can introduce themselves again, we would appreciate it. And I am going to record the mayor's remarks separately, and we'll be posting that publicly for individuals. Okay, Pam Davis from the city, I believe you're up next.
Thanks, Sarah, and thanks, Jeff, for your participation in this as well. My name is Pam Davis. I am your Assistant City Manager here in Boulder, as well as serving as the COVID Recovery Manager for the city. And so I want to take a few minutes to update you on the role that the city specifically is playing in this response effort alongside of our partners and our community. This past week has been a significant one in terms of action by the city and our partners. The first is that we've believed in a collaborative and integrative response approach to lead to better outcomes. And so the city has partnered in establishing a new Boulder area command structure led by our Office of Emergency Management and CU Emergency Management, so that all involved agencies are being brought together to plan and implement any strategies to address the increase in cases among young people and college students in Boulder. We do have a significant number of city staff involved in this effort. As you heard Jeff explain, our health department partners have implemented an important new public health order. The city does support the data-driven approach and has worked closely with public health to provide the addresses and data necessary to make these decisions. The orders will impact all 18 to 22-year-olds in Boulder, as well as about 1,000 residents in the specific households contained in the order. We do understand that this will have a severe impact on people's lives, but we hope that the measures will allow us to stop the spread of this illness. To our young adult neighbors in Boulder, we are grateful for the contribution that you will be making over the next 14 days, and we thank you in advance. So also in preparing for these briefings, we've been working with our police department so that we can provide you a snapshot each week of the enforcement action being taken by police in the previous 7 days. And so I want to share with you some numbers related to enforcement activity on the Hill in the past week. The first is that we've received 84 complaints related to nuisance activity, which is defined as disturbances, fireworks, noise complaints, or public health order violations. Of those complaints, at least 5 warnings were given, several incidents of gone on arrival, meaning that once officers responded, the incident could not be found. On the Hill specifically, 2 citations for nuisance-related activity have been issued, and citywide, there have been a total of 8 issued for college-age students. Since this is our first briefing, we'll also share with you that prior to the previous week, all total, there have been 54 citations for violations of public health orders in Boulder. Overall, our health compared to last week is that as of 8 a.m. on Wednesday, we were holding steady compared to last week in regards to the numbers of complaints we are receiving to the Boulder Police Department. We do want to be clear that while we are stepping up enforcement in relation to violations of the public health order in more egregious cases, the city's primary objective does continue to simply be behavior change. It is far preferable for us to achieve this through education as opposed to enforcement. Our communication and engagement staff is heavily involved with their counterparts at CU, the county, and in public health to step up messaging and information at this time. And so I want to wrap up with just a few pointers on what you as community members can do to help us during this time. The first is to support our local businesses, particularly on the Hill. These businesses are open and restaurants are offering both dine-in and takeout service. Students will not be frequenting these businesses during this time, except maybe for contactless delivery or to pick up takeout food. This does mean that businesses will sustain a temporary reduction in their customer base. And these health measures have been taken in part so that these businesses can operate safely and continue to serve Boulder residents who are not in the 18 to 22-year-old age group. Please do come show them some extra love during this time. The second thing is please follow all health guidance that you've received, and Jeff provided a great summary of that. The other is to utilize test sites if you have concern of exposure. We have a couple that have been recently stood up in the community and encourage you to visit those. If you do see something that causes you concern, please report it to Boulder County Public Health. You can also call the non-emergency police dispatch line at 303-441-3333 to let the city know. Officers will be doing their best to respond in a timely way, but they will also need to be prioritizing your calls with others occurring in the city at the same time. The university is also offering a form to report potential student code of conduct violations, and our university partners can answer questions about that. And finally, Boulder, let's try to continue to be patient and caring with one another. We are all in this together. Thank you.
Thank you, Pam. Okay, we'll turn to our university partners now. We'll start with Pat O'Rourke, and then we'll go to Molly. If you two could, again, just introduce yourselves to our attendees, that would be wonderful. Pat, you're on mute, I'm afraid.
I'm sorry, am I audible now?
Yes, you are.
Fantastic. So thank you. Again, my name is Pat O'Rourke. I am the Interim Executive Vice Chancellor and Chief Operating Officer for the Boulder campus. I'm really pleased that Molly Frommelt was able to join me today. Molly is one of our tri-executives who leads our student government system and she will be very helpful in speaking from the student perspective. I'd like to start by expressing my immense gratitude for the partnership that Pam Davis described a few moments ago. We have joined the Joint Command structure in order to be able to help the city make decisions and the county. We're committed to being strong and integrated partners with the city and the county in addressing what is undoubtedly a crisis that we need to contain. I also really appreciate Mayor Weaver, the City Council, and Executive Director Zayak's leadership. They are serving the community well. We understand that the COVID outbreak, even if it's largely been contained amongst CU students, is of significant concern to the community. It's of significant concern to us. We recognize the role that we must play in being able to bring the COVID infection rates down to help the city and the county avoid that stay-at-home dial that Executive Director Zayak described earlier, and our obligation to take whatever measures we can to support the city and the county. As you heard, there are a new order that has been placed into effect today, and from where CU sits, there's two very significant pieces of that order. First is the stay-at-home that is being implemented that is going to address more than 30 off-campus CU homes. We recognize as well that those residences have been the subject of concern. Those are something that we fully support the measure that's been taken by the county in order to be able to address those localities. And in many instances, we have already initiated student conduct proceedings and other measures in order to be able to reinforce. The other really important feature of the order is the provision that deals with gatherings and the limitations that it places upon 18 to 22-year-olds. We know that this will be a hardship not just on the 18 to 22-year-old members of our student community, but the broader members of the community as well. And we recognize and support that this is what is necessary in order to be able to break that chain of infection. Nothing is more important at the moment, and we will want to be good partners along with the county in being able to do that. We've called upon our campus community to take action. Earlier this week, we moved to remote instruction for the next 2 weeks. That is a strategy that other institutions across the United States have successfully used to break a chain of infection, and we know that the order today is a stronger measure. We've been taking action throughout and will join with the city and county to take additional actions to protect the community. We're also very grateful to CDPHE for its assistance in establishing additional testing in the community, both on the Hill and a drive-up location, to be more able to broadly serve the needs of the community. We've already had much testing available on campus and to be able to track what the trends are, and we're beginning to see the results of our efforts. The positivity rates for our surveillance testing are decreasing, and we expect today's order to accelerate that trend. Last weekend, as Pam Davis just described, Boulder police reported fewer large gatherings and noise violations. Today's order significantly increases the expectation for our 18 to 22-year-old student population. We absolutely respect the county's judgment on these measures that will lead to the most effective control of disease in the community, and we'll work with the county to implement that order. And we've increased our enforcement. Not only are CUPD and the Boulder police engaging in efforts to be able to look at the Hill environment, but when they identify people who have engaged in violations, they are referred to our student affairs personnel for conduct proceedings. Interim suspensions have already begun to be implemented for those who have engaged in behaviors like hosting parties or violating isolation and quarantine orders. If found responsible after receiving due process, those students will presumptively be suspended for the remainder of the academic term. Our students have told us that they value the ability to be able to continue their education, and we are counting upon them to engage in the behaviors that will allow them to do so. We're part of the Boulder community, and we need to help find solutions. Executive Director Zayak talked earlier about the fact that the rate of infection has been growing in the student population and that the infectivity rates in the broader county have remained stable. We know that our students have not needed to be hospitalized or to draw upon significant medical resources for the community, but the rates of infection in our student population are not acceptable, and we need to break the chain of infection while supporting our students' physical and mental health needs. We know that those needs are acute at the moment, and we want to be there to be able to provide support for our students, to be able to make sure that they have access to the resources to be able to continue their education, even if it's occurring remotely, to make sure that they have financial security for those who are living off campus, to make sure that we are providing mental health resources. The strain of being in isolation is very immense. And we know that it's been harder for our students to do things like be able to make friends during a time when they've been physically distanced and separated. So we need to express our care and empathy for them. As we move forward, please, members of the community, don't think of the students as the enemy. They are part of the community. They've engaged in some behaviors that are not acceptable to us. We want to be able to address them, but we also want to be able to express compassion for them and care for them. And to the extent that you can help us send that message of care, that will help us make it through this crisis and be stronger together. With that, I'd like to turn it over to Molly Fromelt, who is able to give us that student perspective and talk about what CUSG is doing so that we're in a position to be able to work through this crisis together, make sure that we can minimize the impact on the broader community and emerge stronger and have CU be a really strong partner for everyone in the city.
Thank you. Thank you, Pat. Good morning. My name is Molly Fromelt, and I am one of 3 student body presidents at CU Boulder, along with Isaiah Chavez and George Conway. I'm grateful that we have been given this opportunity to directly address the community, as I've been working with various community groups, such as the Hill Revitalization Work Group and the University Hill Neighborhood Association for the past 3 years. Through our communications, these groups have proven their willingness to differentiate the general student population who abide by orders and guidelines and the minority of students who unfortunately do not. While we continue our efforts in addressing COVID-19, I would like to emphasize that the purpose of CU student government is to represent students to administrators, faculty, staff, legislators, and the community, and additionally act as a liaison to the student body. As a student government, we are unfortunately do not have the policy-making ability of administration, nor the enforcement mechanisms of student conduct and law enforcement. But we have been and will continue to support the measures that have been put in place by our community, and specifically pertaining to the student population. We are aware of the immense fear and anxiety that the Boulder community continues to endure, but I would like to also stress the majority of student population is experiencing these feelings as well. As a student body collectively, we are actively trying to assimilate to circumstances that are not only unprecedented, but have also revealed inequities among many areas within this own community. We feel it is important to acknowledge the immense fear, anxiety, and fatigue that this is placed on students, specifically considering the non-negotiable rapid immersion into an alternative college experience and learning environment that is not comparable to anything that anyone has ever experienced before, including limited social interaction, limited opportunities to engage in social activism, and little optimism, frankly, about what our future holds for our education and careers. We will continue to advocate, educate, and inform, which includes an increase in social media presence, maintaining support for the university and its enforcement entities, and ask that the community views the student population not as a problem, but as a population that is willing and wanting to aid in this process of ensuring that the Boulder community as a whole regains health and confidence moving forward. With that, I would like to provide a few specific updates that CUSG is currently doing. Firstly, CUSG is working to solidify the information that students receive from the university, city, and county to make it more accessible, including making students aware of testing sites and resources. Number 2, CUSG is working with Vice Chancellor Jennifer McDuffie to monitor on and off campus testing sites and the increasing number of students who are choosing to get tested. This work has also included the participation of Greek Life, which has been facilitated by our new Dean of Students, Austin Banks, by ensuring that they remain in communication and in compliance with orders that have been placed by their individual chapter houses, the university, and the city. Thirdly, CUSG is working with student conduct to ensure that quality education regarding COVID-19 is being communicated and that there are proper enforcement and disciplinary measures established in order to address those who choose to not follow them. And finally, CUSG is supporting the student body by forming a basic needs advocate within our executive cabinet to address the exponential increase in food, housing, and financial insecurity among our student body. Again, I would like to thank all of you for allowing a student perspective to join this conversation today. And I look forward to working with you all in the future. Thank you.
Thank you, Molly. Okay, our last speaker is our colleague from Boulder Valley School District. We know there might be some parents on the line who have some questions about how this impacts school operations. So Randy, if you can briefly update folks, that would be great.
Thank you, Sarah. I really appreciate this opportunity. Similarly to others that have spoken today, we really want to first start by thanking the Boulder County Public Health folks for all their partnership from the beginning of the situation back in March, when we were forced to close our schools pretty quickly in order to slow the spread of COVID-19. And following up through the summer as we were planning, we created a plan with their support and help. And I should mention that we're in multiple counties. Broomfield Public Health has also been part of this effort as well. But with their great insight and help, we've been able to build a plan that's multi-phased, that really looks at the expectations that would be at different phases and try to be prepared for all these different flexibilities. We run into some challenges along the way, and as you may know, we started the school year in remote learning because we had some logistical issues. Simply put, we had a number of our staff members that were on exemption because of the health allowances that are provided underneath the governor's health orders. And so, with as many people as we had planning to come back, we didn't have enough staff members to do that safely or effectively. And so since then, through August, we have been working on additional plans. We brought together in great collaboration with our teachers union, the Boulder Valley Education Association, as well as our principals and parents, a committee that's really been working on how, safely bringing back our students and bringing ideas about how to overcome those challenges, how to prioritize the groups of students that we have. As a K-12 institution, we have a lot of different needs, all the way from our youngest students to our seniors, and the decision was made, by that group and recommended to the district that we start with our youngest learners because they are less independent when it comes to learning. It requires a lot more support from parents at home. They're not able to do these lessons on their own. We're certainly working with them on that, but in front of a computer screen remotely, it's a little bit more difficult. And so, starting on September 29th, we'll be bringing back our K-2 students, as well as our students in intensive special needs programs, students that are coming from other countries as part of our newcomers program. So you can kind of see these are students with intensive needs that can't be met as easily through remote learning. That being said, we know that our students across the board are deeply impacted, and similarly to what our colleagues at CU mentioned, we understand deeply the concerns that are going around and continue in regards to COVID-19, the stresses and the fatigue that our students, our families, and our staff are feeling as they are trying to go through a completely different way of learning at this point. We are at this point trying to re-engage students. We have a plan to bring all students back over in a staggered sort of approach over time between here and November. But again, we have some significant challenges that we're trying to overcome. And so those logistics are things that we continue to work on as we go throughout this. And again, with that partnership with public health, with them guiding us through the situation that's going on right here in town, and whether or not that will impact our K-12 students. And at this point, it appears with their guidance that we are going to cautiously move forward. But again, we're prepared for anything that might happen. The idea that we will have, and we look at our other colleagues across the state. We have other school districts in nearby neighboring districts and across the state that have gone back, and through the kinds of things that we plan to implement, have been able to ensure that if there's a suspected case or a confirmed case of COVID-19, that quickly that the school, the cohort that's involved is shut down, and so that there's not massive spread within that community. We've had our childcare running since the beginning of this crisis, and we are proud to report that we've had no cases of COVID-19 as part of that. So we believe by starting small and taking these staggered approach into bringing students back, that we'll be able to do it safely in partnership with the county public health department, that we're able to really monitor what's going on around us and make smart decisions in regards to whether or not We need to modify this. Our hope over time is that we'll be able to bring all students back, and that our staff and students and everyone in our community will feel safe doing that. And again, I really appreciate the opportunity to be able to speak and answer people's questions. Thank you.
Thank you so much to all our presenters. We got through the updates very quickly, which is wonderful. It allows us a little more time for questions. As a reminder, I'm Sarah Huntley. I'm the Director of Communication and Engagement with the city, and I'm going to be facilitating our Q&A. We do have a number of questions that have come in the Q&A box, and that is our preferred method for getting your questions. We do have roughly 30 people who are on the phone, and I want to recognize that they can't put their question in the Q&A box. So if you are on the phone and you have a question, if you press *9, it will give us a hand raise that indicates you would like to ask a question. I am going to prioritize the hand raise only for people who are on the phone, because if you are not on the phone, you should be able to write your question in Q&A. So we're going to go with our first question. And I want to make sure this might have been made clear in the presentation, but it's really important for people to understand. So Jeff, this one will go to you. An individual wants to know if the new order affects 18 to 22-year-olds who are not CU students.
I'm gonna have Kate Haywood, who's with the county attorney's office, address that.
Hi, everyone. Yes, this is Kate Haywood with the Boulder County Attorney's Office. The gatherings prohibition does apply to all 18 to 22-year-olds in the city of Boulder, irrespective of their affiliation with CU.
Okay, terrific. We have a number of questions related to enforcement, both of the general gatherings provision as well as monitoring and enforcement of the 36 campus homes. Kate, I think maybe you are a good person to start with that. And then we also have Tom Carr on the line who can probably respond to the enforcement questions. Kate, were you going to go first?
Oh, I apologize. Is the question just generally how will the orders be enforced?
Yes.
Okay, great. So I will start by saying that violation of public health orders are considered a Class 1 misdemeanor under Colorado statutes. Public health order violations also violate the City of Boulder Municipal Code, which carry penalties up to 90 days in jail and a $1,000 fine. And then public health order violations also violate the CU Student Code of Conduct and subject students to discipline by CU. Over here at Public Health, we're working closely with the City of Boulder, CU, Boulder Police Department, and CU Police Department to coordinate these enforcement efforts.
From my perspective, the Boulder Police Department can write citations for anyone found in violation of the order, any people gathering outside, any people who leave any of the residences that have the stay-at-home orders in place. The city police department has extended their authority to write tickets to the CUPD resident service officers. So they either of those groups can write tickets to the Boulder Municipal Court. Those cases will be prosecuted by our office. Those are criminal prosecutions. We also report every violator to CU, who has their separate disciplinary process.
Okay, thank you. We have a question about the escalation of restrictions. So after the stay-at-home recommendation last week, we've now escalated to some mandatory restrictions. The individual wants to know if that was too little too late, given what we've seen since, or if public health had anticipated being on an escalating scale.
So this is Jeff Sayak again with Boulder County Public Health. We had hoped that the 14-day self-quarantine would have a greater impact, but we were always planning on, if that was not going to work, what would be our next escalation. So again, we're hoping that we would see a greater impact associated with that, but are not yet seeing any kind of downturn in cases and are still seeing some challenges with some of the gatherings. So we decided to move it to this level. And again, for those of you who might have joined late, that was in consultation and support with the Colorado Department of Public Health and Environment, as well as the City of Boulder, who's been a key partner in helping us support the enforcement of that, as well as the University of Colorado, who also is helping enforce that as well.
Thanks, Jeff. Councilmember Wallach, I see you have your hand raised. Would you like to respond to that question?
No, I had my own questions.
Okay.
I will wait in the queue.
Okay, thank you. Can you raise your hand again, please? Because I put it down for you, anticipating you'd speak now. Okay, we have a question about how long the no gathering order will be in effect for 18 to 22-year-olds. Is it 2 weeks, or is it really until the infection numbers become stable for 2 weeks?
So
Go ahead, Kate.
I was just going to say that the public health order, including the gatherings prohibition, is in effect through noon on October 8th, and it will be reevaluated by public health as that date approaches. And Jeff, if you have anything else to add.
I would just add that if we are at the end of 2 weeks and we're not seeing declines in cases, then we would definitely be looking at what are our next steps in terms of how we do get those cases to come down. What we can't do is have cases just continue to escalate.
Okay, Jeff, you cut out there, but I think you had pretty much completed your thought. We have a couple of restaurant owners on the line today, and they want to know if restaurants have to identify 18 to 22-year-olds and take some kind of action from preventing them from gathering or eating at a restaurant. I'm hoping one of our health department attorneys can answer that question.
Yes, Kate Haywood with the Boulder County Attorney's Office. I can answer that. There is no affirmative obligation on the part of business owners to enforce this order. Of course, public health, we would encourage business owners that do see violations to report them.
Okay, thank you. This is probably a question for Pat O'Rourke. Can you confirm if CU has jurisdiction over students living off campus if they violate city, county, or state ordinances?
Thank you, Sarah. Yes, they do. And we modified our student code of conduct to be clear that any violation of a public health order, either on or off campus, is something that results in referral over to the disciplinary process, and that is currently occurring.
Okay, thank you. While we have CU up, there's a question from somebody who actually asked quite a few questions, but I'm going to try to give everybody a chance. So why did CU execs decide to bring students back to Boulder, knowing the health risk of the pandemic and that there might have been other options?
So I want to start by acknowledging that we did make a decision to return students to campus. We did that not in isolation. We did consult with experts in epidemiology, as well as what we needed to do in order to be able to create a campus environment that was safe. We made the same judgment that many schools around the country did. There are some schools that started remotely, but even those who have started in all remote status, for example, UCLA and Washington State, they've seen many of the same problems with infection in their communities because the student population had returned to those communities or actually never even left the communities to begin with. And so the decision to return people into the campus community would not have been a means of avoiding COVID infection. What we need to do is to be able to recognize that we have to address the behavioral conduct that is occurring. We're partnering with the city and county in order to be able to do that. And we also knew that we might have this type of situation arise. We anticipated from the beginning that we might have to change status based upon the presence of infection in the student community. And we're working with our partners in the city and the county and the state to be able to take the situation that we have at the moment and be in a position where we're able to affect the disease.
Okay, thank you. We have a number of questions about testing, so I'm going to group those into one if I can. The first is, can the city commit to making testing sites free and available beyond October 2nd? The second is, we have an individual who was tested at the ball field 4 days ago and hasn't received results. So maybe we could talk a little bit about the turnaround. And then the last related question I'm seeing right now to testing is, why is CU's testing system not applying to off-campus students? So let's start with the testing sites. Pam, is that something you have information on in terms of whether they can continue?
So what I can share is that I know we have ongoing conversations about identifying a sustainable source to maintain those test sites. Beyond that, I might look to either Jane or Jeff to see if there's been any additional movement on that conversation in the last 48 hours.
Hi, this is Jane. I'm the Boulder City Manager. Pam and attendees, I haven't heard anything recently about it. That site is actually being operated by the Colorado Department of Public Health and Environment, and they are using National Guard to help them do that. I believe that they have other outbreaks that they are looking at. So we're working with the Office of Emergency Management and our partners in Boulder County and CU and public health in order to figure out a way that we can keep that going longer, but we have no commitments at this time with regard to that.
Pam, do you know how long test results are taking for people to hear back?
This is Jeff. I can
Thank you, Jeff.
take a shot at that. So what we were hearing was that it was less than 3 days. So what I'll do is I'm hoping that Chana, who's on the line with us, can help us find either the number for the state lab or a number where we can give that person to do a follow-up. We shouldn't be seeing test results that are taking that long.
Yes, I can
Thank you.
add to the chat with that. Our understanding is you get positive results within 24 to 48 hours, and a negative result is taking about 5 days. But I will put that number in the chat.
Thank you, Shauna. We also had a request to post information about how to read the order. And I know the county health department has created a wonderful website. Perhaps you could put that URL in the chat as well.
Absolutely.
We have a question about whether 18 to 22-year-olds can participate in volunteer activities at city or county nonprofits. You might also, Kate, just if you're going to answer that question, answer the question about who can work and who cannot work.
Absolutely. Yes. So there is no exception to the gatherings prohibition for volunteer activities, but there is an exception for individuals 18 to 22-year-olds who are not subject to stay-at-home requirements. They are allowed to go to work as employees of a business.
Okay, terrific.
Kate, just to clarify, if an 18 to 22-year-old is volunteering, and that would not be in violation of the gatherings because they're not with other 18 to 22-year-olds in that activity, they'd be able to do that.
Yes, that's actually a good point. Thank you for clarifying. So if a 18 to 22-year-old who's not under stay-at-home, if they are volunteering alone, then they can do that. If they are volunteering with other people, they are not allowed to do that.
We have a number of questions about how CU is enforcing disciplinary procedures. Pat, do you want to just talk a little bit? I think at a previous call, you were able to share some numbers on how many students have been subject to discipline related to public health orders. Again, we have a number of questions about that.
And actually, as of today, there is posted on the CU COVID website issues on or data on the number of cases that have been referred over for student discipline, as well as a discussion about some of the disposition of those cases. So that's a resource that people can access on an ongoing basis. Currently, we have several hundred cases that are in the process, and that the overwhelming majority of those are not the type of situation where they're leading to immediate separation from the institution. What we know is that many of those are, for example, a student who is walking across campus and is not with others, but might not be wearing a mask at the time. That's a very minor infraction. For more serious infractions, we are in a situation where we are issuing what are called interim exclusions. That is essentially people being excluded from being able to participate in the educational activities. We are also imposing interim suspensions for the most serious conduct violations, including things like hosting parties or not observing isolation and quarantine requirements. We have issued, since changing the rules on interim suspension last week, 14 interim suspensions. We have issued 48 interim exclusions. And so those cases are being then adjudicated through the student conduct processes. And they could result, if determined positive to have occurred, in either probation for more minor offenses or suspensions on an ongoing basis for the more serious violations that are established.
Thank you. We have a question about CU data, so I think I'll stay with you for a moment, Pat, if you don't mind. So for the week of 9/8, there were 806 PCR diagnostic tests with 117 positivity results. That was at 18.4%. The person then describes the positivity and the number of tests for subsequent weeks. And it looks from your site like positivity is declining. Is that because you're only looking at within the weekly set of data itself as opposed to all the data across the board?
So what we need to be able to do here is distinguish between the various types of testing that we have. First, we do wastewater testing to be able to look at the facilities and be able to determine where we may have potential outbreaks. We then have surveillance testing, where we're testing thousands of students and receiving the results back. And then those students who receive a positive surveillance test result are referred over to medical services for diagnostic testing. What we have found is a very high rate of confirmatory tests. And that's exactly what you want to see, because it shows that your surveillance tests are working. So when we're talking about our testing rates decreasing, that's in large part due to the surveillance testing rates decreasing and showing us the decrease in the number of cases in our general population. We still anticipate that we should see a high rate of positivity result on the confirmatory tests, because that's what you're doing, is you're going back in and being able to work to be able to find those cases that have already been identified as probable. The reason that that number is not even higher than it is that those PCR tests, the type of diagnostic testing, is also being used for anybody who appears that is symptomatic. And those symptoms could be generated obviously by COVID, but also could come from other places, particularly with the smoke, allergies, other people are coming in. And so negative test results for that population of symptomatic people who are confirmed not to have COVID are also reported in that PCR testing.
Thank you. We have a question, I think probably for health and maybe for CU, about whether when there's positive test results, what is the effort to do contact tracing these days, and do we feel like it's being effective?
I'm gonna see if Emily Payne, who's our epidemiologist and data health specialist, wants to take that question.
I'm sorry, would you repeat the question?
The question has to do with contract tracing when there are positive test results, both in terms of the health department and CU.
Oh, absolutely. So when we investigate a positive case internally among anybody, including if that's a CU student, we collect any type of contacts from that person and follow up with them within 24 to 48 hours. When we also receive cases that are CU students, we're usually able to recognize that using some resources that we have to determine that. And we work with the CU Wardenburg team to actually send some cases to them for case investigation. And they actually have a very large team. I'm not sure if somebody from CU might want to speak to this, but a very large team of contact tracers that are doing such amazing work. I mean, we're getting a large number of contacts due to our large number of cases, and they have been able to keep up with those, and it's been very impressive. So people are getting followed up with quickly, including student contacts.
And I can follow up quickly, Sarah, which is that we do have that contact tracing capability. When we are receiving confirmed positives through our own testing, that triggers that contact tracing capability oftentimes within hours, and that contact tracing is often completed within the same day. it's been one of our most effective tools so that we can move people into isolation and quarantine when we have a need to do so. And I should have mentioned earlier that a good number of those PCR tests are also people who we've identified through contact tracing as potentially have been exposed. And obviously, if they're tested and come back as not having been infected, those would also be part of those negative numbers that are reported on the PCR tests.
Okay, we are coming close to the end of our time, so I'm going to try to prioritize a couple questions that I think probably have broader interest amongst the group. So there seems to be a little confusion about the gathering for 18 to 22-year-olds. I think people are clear that 18 to 22-year-olds cannot gather with each other, but can they gather with individuals in other age groups?
Kate Haywood, Boulder County Attorney's Office. No, the gatherings prohibition prohibits gatherings that involve any 18 to 22-year-old.
Kate,
And then there's also,
I think, can I jump in? I think the question was, could
Yes,
an 18 to 22-year-old person gather with people outside of that age range?
Correct, and they are not allowed to. The gatherings prohibition prohibits gatherings of any individual 18 to 22-year-old gathering with any other person.
and children under the age of 18 can continue to gather with each other. There was a question that appeared to ask about younger children. Can 18 to 22-year-olds pick up food or grocery shop?
So individuals 18 to 22 years old who are not subject to stay-at-home requirements, they are allowed to, on their own, alone, go into any business, including a grocery store. Individuals under the stay-at-home restrictions are only allowed to obtain food via contactless delivery or curbside pickup.
Okay, thank you. How about city enforcement on open space, sidewalks, and other public places in the city? Tom, is that something you could address?
Sure. I mean, there is a constraint on our enforcement resources. We don't have that many open space rangers. Most of open space is outside of the city and not covered by the order. Obviously, the Chautauqua trailheads are covered by the order, so we will do enforcement there. The police department is coming up with a plan to enforce on the streets. We have asked them to cite and not warn, but to be aggressive in their citation, particularly in the Hill area. So we expect to see significant citations if we do not get compliance with the order.
Okay, we've answered 34 questions today. We have a few more. I want to put up a screen that shows people how to ask their questions after this session. We will answer, if you've already asked your question in the Q&A box, you don't need to email in a new question. We will keep a record of this. But if you didn't get a chance to ask your question today, I'm going to share a screen that gives you some information. And I apologize to those of you whose questions I didn't get to. We have a commitment to end at 9 o'clock. So let me go to my share screen. I'm sorry, at 11 o'clock. Okay. Hopefully you can see a share screen that has some websites on it. Can somebody verify for me that that's what's showing up?
It is showing up, Sarah. Thanks.
Okay, terrific. Thank you, Pam. So the first is an email address. This is an email address the city has set up for community members who have questions for any of the partners who are on this call today. You may email in your question. We're going to do our best to answer as many questions as we can between now and the next briefing. I will remind people we're going to hold these briefings weekly. So we'll have another one next Thursday. Subsequently, the briefings will be 45 minutes and we'll start at 10:15. If you already signed up for this briefing, you will receive an email with the new link. You do not need to sign up again. But you're also encouraged to check the community briefing website between now and then, because that's where we'll be posting answers to the questions. We'll post city answers directly on that site. CU has agreed to share their answers with us, and we will post them on that site, and CU may also post them in their frequently asked questions. And the health department will be posting its responses to its own site, but we will have a link there so that you can see the answers that come in between now and the next briefing. Again, I want to thank all of our panelists for participating. I want to thank all of our community members for participating. We had a great deal of community interest, which leads me to believe, hopefully, that these briefings will be helpful to people. We encourage you to please share timely and accurate information with your neighbors and refer them to the city COVID site, to CU's COVID sites, and to the excellent public health site that just went live this morning related to this order. And Shauna has put that in the chat box. And with that, I think I will close out today's briefing. Again, we appreciate everybody participating. The recording will be on the community briefing page within the next day. And as I mentioned, I will record again the mayor's comments because those were missed in the original recording. And those will also be available on the community briefing page that you see the website for on your screen. Thank you very much, everybody. Have a good rest of the day and be well.